Degenerative disc disease is not actually a disease. Look, I have patients come to me all the time and they tell me they have degenerative disc disease. And a lot of people think this is the disease that they caught or is genetic. But here's the thing. Degenerative disc disease or osteoarthritis is not something that's caused by a bug. It's not caused by a virus. It's not an autoimmune condition. It's not a genetic condition. Now, you do get some degeneration in your disc over time as the natural part of aging, but even so, in most scenarios, the disc degeneration that we see that causes people problems is not caused by age. You see, it is a mechanical issue. There is a specific reason that a disc starts to break down and decay. So it's something that develops. There's generally a cause that can be identified that's not caused by a virus or a bug or genetics or autoimmune. There's always a reason it happens. And the reason I'm saying this, when you look at someone with degenerative disc disease, it is not something that develops throughout their whole spine. Now, they may have some degeneration throughout their whole spine or a little bit overall, but typically people are going to have some very specific areas where their spine has broken down and their discs have decayed much more than other areas of the spine. If it was simply caused by age, you would have the equal amount of degeneration throughout the whole spine. Hi, I'm Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. And if you're watching this and you have degenerative disc disease and you also have scoliosis, you may want to download our free ebook called Scoliosis Has No Age Limit. And you can do that by just clicking on the link below. Now, to really understand degenerative disc disease, let's first understand what are the discs in the spine and what is their function. When we look at the spine, it is made up of a series of 24 vertebrae. Each vertebrae is separated by your disc. Your discs are actually connective tissue. It's cartilage that connects the vertebrae above to the vertebrae below. Now, being cartilage, for the most part, it is avascular, meaning it does not have a direct blood supply or it has a very minimal blood supply. Now, this is important because the discs are mostly water. In fact, when you're younger, the disc is about 80 to 90% water. Now, the disc is made up of two parts. In the inside, you have a fluid-like gel called the Nucleus pulposus. That is almost entirely water, or 80 to 90% water when you're younger. And then that's surrounded on the outside by a fibrous ring of connective tissue called the annulus fibrosus. Now, when you're younger, that outer fibrous tissue is about 60 to 70% water. But as discs start to break down and decay, the amount of water in that disc can decrease, and a lot of times it can get as low as 40 to 50%. So degenerative disc disease is literally the dehydrating or the shrinkage of the disc between the vertebrae. Now, a lot of people think the disc is there to act as a shock absorber, but the disc is not really a shock absorber. In fact, the disc in many cases are actually stronger than the bones. And we know this because someone can actually get a disc herniation where the center of the disc actually punctures the top or the bottom of the vertebrae because the disc is actually stronger than the bone. So the disc job is there to actually add for structural support and stability of the spine, to connect the vertebrae, to keep them connected, and also to allow for proper spacing for the nerves to exit the spinal cord and to properly go to whatever body part they control without being irritated. Now, what happens as the discs start to break down and decay, and if they degenerate, you lose disc height, you lose strength and stability and flexibility, you lose the ability to absorb normal pressures on the spine, and you start to get a narrowing of the opening of the nerves that exit the spinal column and go to different parts of the body. So when someone gets degeneration, they may or may not actually have pain in the disc. They're more prone to injury. They're more prone to get irritation in the facet joints, which are the back two joints in the spine. Because the disc compresses, you put more pressure on those facet joints, and you're likely to develop irritation to the nerves, which can cause pain or radiating symptoms. And radiating symptoms when you get pain is somewhere else in your body, like pain down the back of your leg or down the front of your leg. So if degenerative disc disease is not just caused by age, what exactly causes degenerative disc disease? Well, there's a few big things. The number one thing that will cause degeneration in the disc is misalignment. See, when we look at the spine from the front, it should be straight. When we look at it from the side, there should be a nice curve in the neck, the mid-back, and the low back. And when you have alignment from the front and you have the normal curves, you have an equal or proper distribution of the weight coming down, with part of that weight being on the disc and part of it being on the back two joints called the facet joints. That weight should be evenly distributed throughout the disc and the joints in the back. when you get misalignment, you get unequal pressure on the disc and the facet joints in the back. Also, if you lose a curve from the side, you put extra pressure on those discs. For example, when you look at the curve in the neck or the curve in the back, only about a third, maybe 40% of the weight should be on the disc. The other 2/3 of the weight should be back in the facet joints. But if you lose the normal curve in the neck, like when you get a cervical kyphosis, or when you reverse the curve in the low back or lose or decrease the curve in the low back, all that weight from the back gets transferred to the front of the disc, and they are not designed to carry that normal weight. That extra weight actually causes the disc to start to break down and decay. The same thing happens when you get an abnormal alignment when you're viewing the spine from the front. If you get a curve in the spine, there's going to be more pressure on the disc on the inside of that curve, and that will cause the wedging of the vertebrae, and the disc will start to break down and decay on the inside. Now, another thing that causes your disc to break down and decay is abnormal movement. As I previously mentioned, your discs are mostly water, and they're avascular, and they don't have a direct blood supply. So how discs stay hydrated is through motion. Your discs kind of act like sponges, and when you have normal motion in your spine, it actually wrings out waste and it absorbs more water. We are very sedentary in modern lifestyle, and we are sedentary, or we get joints that get locked up and fixated and don't move. That's called a subluxation. The discs start to break down and decay. So we need normal motion in the spine. But also when we get misalignments, that alone will cause the spine to start stiffen up, which leads to decrease in motion, which can also lead to degeneration of the disc. And another thing that can cause discs to degenerate is excessive motion. You see, not having enough motion is a problem, but having too much motion is a problem. So how do you get too much motion in a spinal joint? If you get an injury, like from a car crash, something like that, and you damage the ligaments around the spine, the joints can move excessively. You see, ligaments connect bone to bone, and they allow for normal motion. When the ligaments get damaged, you can have excessive motion in the spinal joints. And that excessive motion can also lead to osteoarthritis and degeneration or breakdown of the disc. Which leads me to one of the last things that we know causes disc to degenerate, which is an injury or a trauma. You could get a specific trauma to the spine itself that may cause a disc herniation, which basically is when the outside, that annular fibrosis part of the spine actually ruptures and the center gel part of the spine starts to stick through that opening. So traumas can lead to degeneration of the spine. So traumas could also lead to degenerative disc disease. Now, if you're finding this helpful, be sure to hit that subscribe button below and hit that bell icon so you'll be notified when we release new videos. So how is degenerative disc related to scoliosis? Well, a couple of things. First of all, when we look at adults, you could have one of two things. You could have someone that had scoliosis when they were younger, that still has that scoliosis when they're an adult, and that scoliosis begins to break down and decay, which means you have an idiopathic scoliosis that turns into a degenerative scoliosis in adult. Also, you could have an adult that develops a new scoliosis as an adult, and that scoliosis is actually caused by degeneration of the disc and the facet joints. So there's a couple different mechanisms. But from a high level, this is how it happens. So imagine you have scoliosis when you're younger and you have a misalignment in your spine as an adult. Now, because you have that misalignment, you have asymmetrical alignment and you have asymmetrical forces pushing down on the spine, meaning you have gravity pushing down, you have a curve in your spine, there is more pressure on the inside of the disc and the inside facet joint compared to the outside. So you have asymmetrical loading. That causes asymmetrical degeneration. Obviously, if you have more pressure on the inside of the disc, that inside of the disc is going to break down and decay. That causes a wedging of the vertebrae. Also, you have two facet joints in the back of the spine. The facet joint on the inside of the spine will start to break down and decay, known as osteoarthritis of the facet joint. Now, as the disc degenerates and breaks down and the inside facet joint breaks down, that's going to cause more misalignment of the spine. As you get more misalignment of the spine, you get more asymmetrical loading, and then you get more asymmetrical degeneration. That goes round and round, as you can see in the diagram in the video. Now, you could be someone that does not have scoliosis as an adult, but develops in adulthood. A lot of times this will be caused by degeneration. So you may have a facet joint that starts to degenerate. You could have someone that has a loss of the normal curve, meaning they have a reversal of the curve in the lumbar spine that causes the disc to degenerate. And so you get some degeneration starting on one side of the spine. The spine starts to twist and rotate all right? The spinal twist and rotate, that causes more asymmetrical pressure, that causes asymmetrical degeneration, that causes more asymmetrical misalignment, and that process goes round and round. Or maybe you have someone that actually gets a trauma and that causes a misalignment, or they get a disc herniation from that trauma. And so you get some kind of misalignment. So you have asymmetrical alignment. Then you get asymmetrical loads or forces on the spine, and that leads to asymmetrical degeneration. And that also starts to self-perpetuate and just goes round and round. So when we look at adults, whether you had scoliosis when you were younger that you still have as an adult, or you have a new scoliosis as an adult, they become or they are degenerative scoliosis. So how do we actually properly treat degenerative disc disease, and specifically a scoliosis with degenerative disc disease? Well, the first thing we have to do is we have to work on correcting the alignment. Now, when we look at degenerative scoliosis in adults, we cannot actually change the asymmetrical deformity of the vertebrae. So we can't actually reshape the bone when they have degenerated or decayed. And we can't completely rehydrate a disc back to normal. But we can improve the overall spinal balance or alignment. You see, you can look at a curve known as a Cobb angle, and that can be alignment, but then we also have what we call spinal balance. So for example, when we look at your spine from the front, the top of your upper thoracic spine and lower cervical spine should be lined up straight up over your pelvis. When that shifted to a side, that is called a coronal imbalance or a misalignment. That is a spinal imbalance. When we view your spine from the side, the top of your thoracic spine or your neck should be lined up over your pelvis. If that shifts forward or backward, that is considered out of balance from the front and back. That out of balance, that imbalance of the spine, can frequently be improved or corrected even in older adults. So although we can't always restore the curve to normal, we can frequently improve spinal balance, which actually decreases asymmetrical pressure on the disc. The other thing we can do is improve mobility in the spine. You see, if you start to develop scoliosis and you get a rotation of the vertebrae, your spine immediately starts to stiffen up. As it stiffens up, the joints are not moving, then the disc can also break down and decay. Because they're not moving, they get dehydrated. We can get mobility in those joints through specific targeted exercises or things like chiropractic adjustments. So by increasing mobility in the spine, we help treat what's causing the degenerative disc disease. 3, we can actually use tools like spinal decompression. Spinal decompression is a great tool that actually stretches and pulls on your spine. It can be very targeted to the exact segments with degeneration, and as you pull on the disc, you create negative pressure inside the disc. When you have that negative pressure, meaning less pressure inside the disc compared to the outside of the disc, that actually pulls water back into the disc, and decompression is known to help rehydrate your disc. It's also great for healing and helping repair disc when they have an injury like a disc herniation or a disc bulge. Plus, when you're doing that decompression of the disc, that actually unloads those facet joints in the back that a lot of times are being compressed because the discs are being degenerated. So spinal decompression is a great tool to treat degenerative disc disease. But what do we do to actually treat the misalignment I previously spoke of? When we look at adults with scoliosis, there's 2 main tools we have. We have custom bracing, like the Scoli brace, and scoliosis-specific exercise or rehab, like ScoliBounce. You see, when we look at adults, all of our bracings are made custom. And one of the braces that we make or we build into the brace, especially in adults, are braces that work on improving major imbalances in the body to work on restoring normal balance to someone with degenerative scoliosis. We also build in forces to support and stabilize the part of the spine where the scoliosis is breaking down and decaying. Pain is interesting because a lot of adults come for pain, but the actual deformity or the curve itself does not typically drive the pain. A lot of times the pain comes from the compensation of the deformity or of the scoliosis, which is when the body shifts to the side or you start to lean forward. And then when you do scoliosis-specific exercise, we actually teach people how to put their body in a more correct or aligned or more balanced position. And then we actually strengthen and stabilize that in the balanced position. So if you have an adult and you have degenerative scoliosis or degeneration in your spine and you're trying to figure out what you can possibly do to effectively treat this, click on the link below and actually request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis. We can go over the severity and what treatment options may be available to you. And to learn more about the most effective treatments for degenerative scoliosis, click on our next video and I'll see you there.